This next sequence addresses dorsiflexion restriction, or in simpler terms, restriction in the ability to flex the ankle joint. So Jessie, if you could point to the talus bone, good, and then the tibia. So those two bones make up your ankle joint, and the motion that we're talking about that most people are restricted in, dorsiflexion, looks like this. So go ahead and move. Beautiful. So the tibia is gliding over the talus, and some people describe it like a wrench moving over a rounded object. So it's gliding over the talus. And for whatever reason in our culture, perhaps the shoes we wear that prevent motion, this joint becomes restricted in most of the people that we see in our studio. So we're going to learn some ways of decreasing the restriction and restoring range of motion. So before we go ahead and show you the exercises, I'm going to have Jessie first assess her ankle motion. So you go ahead and do this with her. You're just going to move your ankle into dorsiflexion and just notice whether it feels stiff, and also make sure that you're not cranking on the toes, because that's a cheat. So if you, as you flex the ankle, if your toes extend, what we call extend, that's a cheat. So try not to move the toes, but really assess pure ankle joint motion. Good. And you're going to do it on the other foot just so you can compare, but we're going to move on. So this is so you can assess, do our little exercises, and then reassess when you're done, and you're going to feel quite different. So the first one is an actual mobilization of the joint. Jessie's going to first show it on the skeleton. So what we want to do, just to remind you, is we're going to get the tibia more freely gliding on the talus bone. So what Jessie's going to do is she's going to take a yoga strap and she's going to place it on the talus, or the ankle joint, but below the ankle bones. So if you could point to the malleoli, Jessie, so they know. So it's going to go below the bones that stick out on the outside of your ankle, called the malleoli. Okay, so that way you're on the talus, but not the tibia. She's going to pull back really hard on that yoga strap, fixating the talus, and then she's just going to move her tibia forward, gliding it over the talus. So now on her actual foot, it's going to look like, so she's going to, you will want your foot to be elevated on a box. A milk crate is a really nice height for this one. So she's going to pull back really hard on that yoga strap, and then she's just going to move her ankle into more flexion as she pulls back really hard on the yoga strap, and she's going to come in and out a few times. So there's no holding. This is a mobilization. Good. Then with her right hand, she's going to pull back really hard on the yoga strap. So go ahead and switch hands. With her left hand, it doesn't matter which hand you use, when I'm just having her do this for the camera, she's going to grab onto her tibia, kind of close to the ankle joint, pretty close to the ankle joint. And as she flexes the ankle, pulls back on the strap, she's going to crank her tibia in. She's really going to rotate it in, and she's going to back off. So there's no holding. She's going to come in and out, really rotating that tibia in. And then she's going to do it a few times, all the while pulling back on the yoga strap. She's going to crank that tibia out. So she's rotating the tibia out as she flexes the ankle. Good. Moving on. The next little exercise for ankle dorsiflexion restriction, you're going to grab your slant board. So if you're watching this video because you took our workshop, you will have a 12 by 12 piece of plywood. We're going to make our own slant board. If you are watching this video and did not take the workshop, you will need a 12 by 12 piece of plywood, really the hardest kind they have, because you're going to weight bear on it, and you're going to make your own slant board. So if you are very restricted, you're going to take your yoga block, or if you don't have a yoga block, a dictionary will do just fine. and you're going to create sort of a minimal angle. But if you're pretty unrestricted, because you've been doing this for a while, you can either just slide the block in further, or you can actually rotate it to the more vertical orientation. You just want to make sure that it doesn't slip out when you step on it. So whichever orientation you choose, Jessie. So that's how you can change the angle. You're going to have it up against a wall, and then Jessie's just going to stand on it with her heels up against the wall and her back up against the wall. And we recommend that you do this. A lot of our clients have one of these in their bathroom. When they're brushing their teeth in the morning or brushing their teeth at night, they stand on the slant board. Or sometimes if you like to watch television, I wouldn't stand on it for hours on end, but you know, a nice 5-minute stand on the slant board would be really good for you. And then don't forget, when you've done these 2 exercises, to reassess your ankle mobility.